The goal of breast reconstruction is to build a new breast and to restore the patient, both body and mind, to where she was before her breast cancer. The beauty of the DIEP flap is that you're able to most closely match the natural breast before it had to be removed from cancer. A DIEP flap, as it stands for Deep Inferior Epigastric Artery Perforator Flap. And it's a breast reconstruction where we take tissue from the abdomen and use it to reconstruct the breast and create a new breast for the patient. The beauty of the flap procedure is that you use your own tissue and it's purely yourself. You don't have to have a foreign body within you. Before the DIEP flap came about, implant reconstruction was very common. The DIEP flap is natural. It feels as most close to your natural breast as anything that you could come up with other than your natural breast. You don't have to worry about the implant rupturing over time or going out of place or becoming infected or having problems with the implant down the road. Once the flap heals and sets well, it's part of your body and it should maintain part of your body and stay there. The DIEP is the pinnacle of breast reconstruction using your own tissue. The skin and fat comes from the abdomen and we can use it to build a natural breast. It feels, looks, and is as close to your natural breast as possible. Typically, the procedure can be done either at the same time as the mastectomy or can be done in a delayed fashion at a later date. The advantage of doing it at the same time as the mastectomy is you're able to preserve the natural breast skin, and so it really minimizes the scars on the chest. Some patients that may need radiation or are a little bit sicker, we can do this flap at a later time. Typical recovery time for a DIEP flap is typically a 3 to 4 day hospital stay. We closely watch in the hospital overnight, make sure the flap does well. After that, patient goes home and 3 to 4 weeks of abdominal pain, no heavy lifting for 6 weeks after surgery, but typically patients do very well. After the 6 weeks, my patients have no restrictions. You're able to return and do any of your normal activities, any athletic activities, working out, biking, riding. You have really minimal limitations after the surgery's healed. One of the beauties also of using your own tissue is not only does it heal the body, but it also heals the mind. Patients have great psychological benefit to reconstruct the breast. It makes them feel whole again after having lost part of their body to cancer. It's a great procedure.